Folks, thanks for coming on the line with us today. My name is John Dubas with Premier Marketing, and today we'll be running through guidelines for the low income subsidy and Medicare savings programs that are available to Medicare beneficiaries that qualify for those programs. The Medicare Current Beneficiary Survey tells us that about 31% of the Medicare population falls under income limits that could qualify them for some sort of assistance that would make them eligible for special election periods throughout the year. So about a third of the Medicare population will qualify for this assistance, and by doing so, they will also qualify for a special election period so we can help them with their health care and medication coverages throughout the year. So we'll spend a little bit of time talking about the financial atmosphere that's faced by this population, give you information on low income subsidy and the extra help programs, as they're sometimes referred to. We'll speak to what a Medicare Savings Program is and the different levels of that assistance, and speak to some other assistance programs that are available to people who qualify based on income and assets. If we look at the overall picture that's faced by a lot of the population that is receiving health care through the Medicare program, we'll note that Social Security constitutes nearly 90% or more of the income that's received by these individuals, and we all know that generally that puts us in a perilous financial situation as we are aging and losing income sources from other locations. About 4.5 million people are actually below the poverty level in 2014. Another portion of the population is actually at the near poor level, which has a great bearing on our topic today. And we realize that in many circumstances, people are in even under tighter financial constraints because of the amount of monies that they're paying out for healthcare programs as well. If we look at the chart of the folks that are 65 plus reporting income, we'll note that below basically $25,000, we're looking at a solid percentage of the people in that age bracket. 55%, if my math tells me correctly. You got a median income there of about $22,000, little over, for folks that fall in this category. And we realize that about a sixth of the Medicare population are actually under the age of 65, medically disabled, and many of those folks face financial challenges as well. If you look at 150% of federal poverty level, and we take that number because that's the maximum amount an individual or a couple can make and qualify for some sort of assistance, be it with medical expenses or prescription drug help, those individuals, as a single person, you're just over $1,000 a month after you take out about a third of the income for medical expenses. So this is a portion of the population that really needs our help, and with a little bit of guidance, we can actually help them receive additional assistance from the government programs. You look at folks that qualify for the low-income subsidy. This is a little bit of a dated piece of material, but you look at it, and there's a good chunk of folks that actually receive subsidy automatically. So there are folks out there that have this coverage in place that we can help immediately. And there's a portion of those folks that are eligible but not receiving the subsidy, nearly 1 in 5 individuals at this particular point in time. And if we're able to reach those individuals and help them get this assistance, we're doing a couple of different things. One, we're making certain that we help them financially, but two, it also creates that special election period then with which we can then go back and make certain that we are addressing their true healthcare needs as well by tailoring programs based on their individual circumstances. Why does extra help really matter? Well, if you look at it, the bottom line of this, some of the other is kind of repetitious, but the bottom line is the value of a low-income subsidy is about $4,000 a year for the average individual on Medicare taking different medications. $4,000 is most certainly something that most of us would stop and pick up in the street. And over the course of the year, for someone who is of lower income, that can make a huge difference in the quality of their life. The benefits of extra help, well, it helps provide access to prescription drug coverage, obviously. It helps protect people from the donut hole. If a person had enrolled late or for some other reason hadn't timely enrolled in a program and was fighting a penalty for their Part D premium, it would waive that penalty. It does allow us that special election period and can help trigger assistance in other areas as well if a person qualifies based on income and assets. When we look at low income subsidy, we're dealing with the federal government in this circumstance, and there are players within the federal government that help determine and regulate these programs. The Social Security Administration and the Centers for Medicare and Medicaid Services work together to administer and educate the public about these programs, and they generally do a pretty good job. It's just that not everyone responds to different sorts of communications from the government and understands what all is available to them. So you've got the Social Security government that handles the application and eligibility determination. They provide the education and make that decision as to whether or not a person is actually eligible for the help. But CMS also helps with the assignment of Part D programs. If they're auto-enrolled, the person doesn't make the choice. There's one selected for them, and it helps coordinate those subsidies for the Part D plans for the eligible enrollees because there are different levels of assistance. To be eligible for this type of help, a person does have to have Medicare Part A and or Part B. They've got to live within the United States. They have to meet certain financial criteria. The income test is based on federal poverty levels, and there's also a resource or assets test that we'll illuminate in just a little bit. And for the people that are deemed eligible for this, they could possibly receive other assistance as well, such as different types of Medicaid, either community-based programs or programs for those that are institutionalized. And if a person's income is low enough, they could actually receive a supplemental security income, information on that to follow, or be enrolled in a Medicare Savings Program of different levels of assistance that we're going to speak to today as well. These groups don't have to necessarily apply for LIS. If they're found eligible for one of these other programs, they will get that subsidy at least for the remainder of the calendar year. There are two levels of assistance. One is the full subsidy, and these are for folks with lower incomes or fewer resources. And then there's the partial subsidy, the partial help for folks with slightly higher incomes or resources. As we referenced earlier in the presentation, these are sometimes referred to as the near poor. Both of these subsidies help eliminate the coverage gap, that infamous donut hole, and they help eliminate the late enrollment penalty if a person qualifies for this assistance. For those folks that qualify for full extra help in 2018, they do not deal with a Part D plan premium as long as that plan is priced within benchmark delineations. And what I mean by that is it's an average cost of a Part D program across the country. Generally, that is right around $32 to $34 a month. The subsidy does take care of the Part B deductible if they're placed into a plan that has such a restriction, and it also standardizes the co-payments. And this is one of the things that we as agents can use as a means of recognizing if someone has assistance. Other things we can do as well, but if someone qualifies for this assistance, you'll see standardized co-payments for generics of $3.35 per prescription, $8.35 for name brand drugs, and for folks that are below the 100% of federal poverty level, those co-payments are even lower at $1.25 and $3.70 for the name brands. There are no co-pays after the individual on a standard type of program reaches $5,000 out of pocket. Let's be honest, if someone's working on a list of medications that are on a formulary and they're going at those low co-payments, they're going to have to take a heck of a lot of drugs to make $5,000. These are some of the income limits that are placed on an individual in the 48 contiguous states and the District of Columbia. It gives us an annual, a monthly income of up to 135% of federal poverty level, which is basically $1,366 a month for an individual, or with the disregard, $1,386, $1,852 for a couple, $1,872 with the disregard, and that's the monthly income. The resource levels, that's the assets test, and this is a limit per individual of $7,560 or $9,060 for the individual as a couple. We have a higher limit there. Alaska and Hawaii have different limits. Obviously, the cost of living in those two areas are much higher, and so the income limits are higher for folks in those areas to obtain this assistance. For the folks that qualify for partial subsidy with extra help in 2018, this is a program that helps limit their out-of-pocket exposure under standard Medicare prescription drug plans, and it has either a full subsidy of the premium or a sliding scale on the premium with an $83 deductible, plan deductible if it's a standard type of plan, with 15% coinsurance for plan covered drugs that are on the formulary. And these are where the higher copayments that we mentioned earlier come into play, of $335 for a generic medication or $835 for name brands after they reach that out-of-pocket limit. As I mentioned, these are higher limits. They go to 150% of federal poverty level instead of the 135 for the full subsidy. And this is where it helps us to keep a singular number in mind when we visit with people and let them know that if their income as a single person is $1,500 a month or lower, they may qualify for additional assistance on the cost of their medications and their drug plan. A nice round number to have in your head. Again, those numbers are higher for Alaska and Hawaii based on the cost of living. The assets tests are also higher for these individuals. What counts as income? Well, Social Security benefits count, any type of retirement program if it's with a railroad, or additional assistance through pensions or annuities, veterans pensions. If the person is still working, those count as income, obviously, against the income test. If a person is receiving alimony, that counts as income. And if they have a rental income on a net basis, it counts as well. That's also something that might come into bear if they're having a rental property. That may mean that they fail the assets test as well. So something to consider. It does exclude food stamps and fuel assistance programs. We're going to talk about them briefly toward the end of the presentation today. It gives a disregard in unearned income, such as Social Security, of $20 a month. And it does take into account some work-related expenses for people that receive Social Security benefits for disability or blindness. There is a live link here that will tell you additional details on those resources, a bit of a cheat sheet that can help you learn more about those, the breakdown of those resources as well. Some of the things that count when it comes to an asset, the resource test. Some of those countable resources include any type of account at a financial institution. So if they got checking, savings, CDs in a bank, if they are stashing cash at home and they admit to it, obviously counts as a resource. They have stocks and bonds, savings bonds, any type of investments in a formal or informal account, that comes into play. Also, real estate outside of their primary home, and certain trusts that allow a person to revoke that trust and have direct use of the funds. So sometimes you see that when people have set up an estate and put money in a trust for their offspring or other individuals down the road. Some excluded resources also include the home in which the applicant lives, all vehicles, cars, trucks, motorcycles, boats, snowmobiles, certain household goods and furnishing and personal effects such as jewelry. It also excludes the cash surrender value of life insurance policies, different in-kind support, which is non-cash help such as shelter, you live with a family member, things of that nature. And then, of course, the irrevocable burial trust and burial contracts that many people put into play for the inevitable. There are a couple of ways that a person can apply for this help and that you can help the individual. They can go online through Social Security's website or through the Benefits Checkup website. This is actually something that you can help the individual with as an advocate on their behalf and do so compliantly. So that's something to take into consideration. The online application is currently available in English and Spanish, and they do accept electronic signatures to complete the application. You can also receive a paper form from the Social Security offices, either by mail or going to the office to pick up one, and then Social Security will make the determination, usually within 3 weeks of a completed application, and send the applicant a decision letter. Obviously, if you do things online, it's a quicker process. It's also a cleaner process because we generally have challenges when we do things on paper because you probably write in the same language I do and our prospects and clients do. That's chickenese, or it's really difficult to read sometimes. So this page does give you a reinforcement of that benefits checkup link. And of course, the state health insurance assistance programs, the SHIP programs, are also a way to help people get the extra help application underway. You have a link here as well to the Social Security website that pulls you up a facsimile of that application. Some things to consider, as I mentioned before, applying online is usually easier and faster. You don't have to supply verifying documents. Social Security will use federal records to verify the answers. If a paper form is incomplete, Social Security will follow up via phone with the applicant. The online application is like many of the tools that we use in the insurance world, where you can't proceed with the application if it's incomplete. So it's got to be complete in order to be submitted. The instruction sheets for it online are available in 15 different languages. And for the folks that are deemed eligible for low income subsidy with that extra help, they don't necessarily have to do a separate application for LIS. If they're doing an application for Medicaid, SSI, or MSPs, when that's approved, they automatically get the LIS assistance, and they will get a letter from CMS letting them know that they have that assistance in play as well. This is how the online application looks versus the paper application. And the online application will ask for some of the basics, obviously, the contact information with name, address, Social Security number. They'll also ask for information on the person's finances, their income, and their assets. It will also make a difference as to how many people are in the house, because the level will vary, obviously, from a single person to a couple. And in certain circumstances, if there are other dependents in the house where that person's income supports more than just the husband and wife or significant others. This is a sample of the letter that a person receives, either with an approval or a denial. It's pretty straightforward. It's important to note, too, that when the person gets this letter, that's an indication for you that that person's records are going to show up in computer systems that allow you to take advantage of the special election period to visit with the folks and help them with choices that may better their circumstances when it comes to their health care or prescription drug coverage. As I mentioned, once the person receives that letter, it's going to trigger the SEP. It will help them then with an auto enrollment if they don't select the plan, and they'll put them in a program that fits that benchmark rate so they aren't charged for the plan either. Or they can call the Social Security Administration and opt out. Why they do that, I don't know, but some folks do. Some additional resources that are available for you to do additional study. There's a couple of pieces in there that are very helpful, in addition to being able to deliver on a facsimile of the application so you know what's being asked, and also being directed to the online application. It gives you some hints and tips related to the program as well. As I mentioned, once the program is in place, it does allow for a continuous special election period. The folks can change their coverages once a month, or each month, I should say, and they don't have to wait till the open enrollment period to change programs. There is legislation in play that may change this from going to a continuous special election period each and every month to a quarterly enrollment period, but that hasn't been rolled out yet. So at present, it's a continuous special election period each and every month. There are also there's also a program for folks that are just getting into Medicare that qualify for the additional assistance and don't have it in play yet, and it's a program monitored through Humana on a national contract. Some of the things that we can do to help our clients is make certain that they have the information they need to see if they qualify for the assistance, help them with that enrollment process or application process, should they feel they qualify. We can also make use of the Medicare Plan Finder at medicare.gov to help them select the different programs that are available and ask them to review the correspondence that they receive, because that's an important piece of it. Many times we get a bunch of mail, it goes on the table, we don't always read it in a timely fashion, and folks are now receiving mailings if they are likely to qualify for this particular assistance. And we'll show you actually facsimiles of that in just a second. We have a link to the letters as well. As we mentioned before, the additional levels of assistance that we'll talk about later in the program, if someone feels they qualify for those programs, they can make application for that process, and it will put them in the queue for LIS as well. Even if they don't qualify for some of the additional Medicare Savings Programs, it would be something that could come into play and help them get the drug assistance without a special separate application. Just keep in mind the income and assets tests for low income subsidy are higher than what they are for a Medicare savings plan. And so what we see are folks that will qualify for drug assistance that won't qualify for Medicare savings programs. So those programs are actually what we'll spend some time on now, and these are different types of programs that can be very life-changing for many of the folks that qualify for these types of programs. We'll discuss the different types of coverage that are available and how they work with eligibility rules. We'll speak to the relationship these programs have with other benefits and how we can help our clients and have resources available to do so. If you boil it down to brass tacks, Medicare savings programs are Medicaid administered programs that are funded by Medicaid and administered by the different state governments that come into play. They help cover Medicare premiums and cost sharing based on limited incomes and assets, and they don't qualify for full Medicaid. They're known by different names in different programs. You'll see MSPs that are called Medicare buy-in programs, Medicaid buy-in programs, Medicare assistance programs, or just go by that lovely alphabet soup, their acronyms. These are programs that basically handle the financial part of the Medicare health system. LIS programs deal with the medications. When we get into the Medicare savings programs, they deal with health expenses. These are really important because in the vast majority of circumstances, I won't say in every circumstance, but normally everyone over the age of 65 and many folks that are disabled receive their Medicare coverage, and it funds their health expenses. But the Medicare program itself isn't free, and those out-of-pocket costs can add up, obviously. As insurance agents, we know that because that's why we help folks with Medicare Advantage and Medicare supplement programs. But many of the folks that are in Medicare can't afford some of those expenses. As we mentioned, half of the people in Medicare had incomes below $26,200 in 2016, and these programs can make Medicare much more affordable for those who qualify. One of the first types of coverages that are listed, and there are three basic coverages, are the qualified Medicare beneficiaries, the QMBs or QIMBs as they're sometimes referred to, and these will pay Part A premiums if applicable. Many people, if they worked 10 quarters in their lifetime paying into Social Security or been married to someone who did, it will fund that anyway. But for the limited folks that have a Part A premium, the QMB programs will take care of that, and also their Part B or medical premium. And it will also pay the Part A and B deductibles, co-payments, and co-insurance with the Medicare programs. The second level of assistance is a specified low-income beneficiary, SLMB, sometimes called a SLMB. This program basically pays that Part B premium only, doesn't cover the other expenses in the Medicare program. And then you also have the qualified individual, the QI1s or Q1s, that pay only the Part B premium. And this is something that comes into play because it basically covers the same things as a SLMB. It's just at a higher income level, a later piece of legislation that used to be covered under a block grant, now fully funded under the MACRA legislation. So three different levels of assistance, one covering not only premiums but also expenses, the other two covering just Part B premiums. QDWI is a program that we need to be aware of. We don't run across it all that often, and it is something that generally doesn't work in the same fashion as what we're accustomed to with the other three types of Medicare Savings Programs. And these are generally for folks under the age of 65 who've lost the premium-free Part A coverage because they've gone back to work after receiving SSDI long enough to receive the Medicare. So this will pay Part A premiums for folks that fall into those categories, and that can make a huge difference in the life of a disabled individual. Some additional things that MSPs do when you're looking at QMBs, FLMB, or Q1s, it does take care of any Part B late enrollment penalty. We run across that occasionally. This program will also waive that for folks that qualify for this. And a bit of a difference versus Medicaid programs that some of us run across when people have gone through a spin down to go into a nursing home. States are not allowed to recover from an estate for the repayments of costs that while the person was under the program after they passed. We see that happen occasionally for Medicaid programs for folks that have gone into a nursing home. And as we mentioned before, if a person qualifies for an MSP, they automatically get the Part D Low Income Subsidy Extra Help program. The income levels that this helps predominantly, but it also gives us an idea of just what this is worth to an individual. Well, it's going to pay that Part B premium, which right now is generally $134 a month for most folks, $1,600 a year. And if you're looking at an individual whose income as a single person is about $1,000 a month, well, you're getting them an extra month and a half of income basically by getting them this assistance. And what we see here then is the breakdown of what Part B costs people based on their federal income tax return. So based on different incomes for a single person versus an individual, their Part B premium can vary. And it's interesting to see that people that are of higher income pay a substantially higher amount for their Part B premium. If we go and look at it logically, though, if you're making over $100,000, $107,000, and you have to pay $267.90 a month for your health coverage cost, that's still a pretty good deal. There are a number of governmental agencies that become involved in the delivery of this care or of this assistance, and they involve federal and state governments, and it comes into play as to how those monies are handled and what premiums it applies to based on the person's qualifications. So to be eligible for these programs, the person's got to have Medicare Part A. They must meet both the income and resource eligibility tests, but these can vary from state to state. And there are actually 8 different states that have eliminated the resource test for a Medicare Savings Program. I live in the state of Texas. I dealt with a lady a few years ago who moved here from Arizona. She qualified for the assistance in Arizona, did not qualify for it in Texas because she had a small CD that pushed her over the limit for the resource test. So we can't assume things that, okay, they got it in one state, they're going to get it in the other. Well, if they live in one of these states and their resources are a little higher, it may not happen. These are generally applications that are submitted through the local Medicaid agencies, and it is an eligibility process that is redetermined each year. The assets and income limits generally go up each year. We've seen a very small increase on average over the last few years with Social Security increases. We see where a Social Security increase of 3% is slated for next year. Generally, that only affects the folks that are very close to qualification limits here when you're talking about such a small increase. The numbers, they vary from program to program. So you go up to 100% of federal poverty level for the QMB, most comprehensive coverage. You go up to 120% for the SLMBs, 135 for the Q1s, and 150 for the LIS programs. QDWI is a completely different animal. It gives you then a breakdown here of what the resource limits are as well. You'll see that that rolls across all 3 programs at the same limits, $7,560 for a single person, $11,340 for a married individual. And with some of these programs, they may be able to go back and refund Part B premiums based on the program. They don't do it for QMBs because they have all the other benefits that are immediately available to them for Medicare expenses. But if a SLMB or QI1 qualifies and it took, let's say, 2.5 months for the individual to actually go through the application process, which does happen, they'll go back and refund some of the monies that they have paid into Part B premiums while they were undergoing the application process. Once again, it does exclude one house and one car in this circumstance, as opposed to the LIS program, which allowed for multiple vehicles. In addition to that house and car, much like with LIS, it will forego household goods and certain pieces of jewelry, burial spaces or burial funds that are put in place for final expenses, and then, of course, life insurance with certain cash value limits. A bit of history on it. QMBs actually came into play by a piece of legislation through Congress in 1988. And a good portion of the people that qualify for this assistance don't have it in place. So there are still people that you'll run across that will qualify for QMB assistance, don't have it, that you can really help. The specified low-income beneficiary legislation came into play 2 years later. An even larger percentage of the folks that qualify for this assistance don't have it in place. So it's important to ask some general questions when you're visiting with folks about their health care coverages, because this can make a huge difference to them. As we mentioned a little bit earlier, the block grant process for QI1s was replaced through MACRA, but the original piece of legislation that created this category was in 1997. So even if you look at the QMB programs that have been in play now for 30 years, the majority of people who qualify for them may not have them in place. This is a nice little cheat sheet that you can use and keep in your presentation binder, because it will give you numbers that you don't have to memorize in that circumstance. So in the course of a conversation, regardless of the trappings of the house or anything where a person lives, it's always important to note that, hey, that you may qualify for additional assistance from the government. Is your income about $1,500 a month gross? And if so, as a single person, you may qualify for additional assistance. Because keep in mind, an earlier slide said 90% of the people, their income's based just on Social Security. That Social Security check generally comes to them after Part B premiums are deducted from it. So you'd have to take that Social Security check and look at generally that $130-some Part B premium to see if they truly qualify based on these limits. We talked about the percentage of people that qualify for these programs and don't have it in place. Why is that? Well, generally it's because a whole bunch of folks don't know these programs are out there. They've had some sort of exposure to low income subsidy information, but perhaps not that same sort of information for Medicare savings plans. And enrolling in these programs aren't always that easy, particularly for a senior population or disabled population that may not have the eyesight or the manual dexterity necessary to work a computer or even an ink pen. And for folks that are aware and realize their limitations and they want to get help, they may have transportation difficulties of getting to the location that could help them with it. That's where our value is even incrementally higher than normal, because we go to them in many circumstances. And then, of course, there's the portion of the population that's aware, capable, but they fear the social stigma that this is welfare and they're not going on the government dole. There are different things that we can help our folks with. Is we ask the basic questions. We're familiar with the rules of eligibility in the states we operate in. We have our cheat sheet that helps us, and we can help the folks go through the application process. And it doesn't take a whole lot of time on our part, and it really makes a difference for the people we're dealing with. And it comes back to us as well, and we'll talk about that in a second. So as we go through and we discuss these different types of coverages, we want to make certain that the folks that are eligible actually qualify and go through the process and know exactly what they need to do to take care of it. Are they going to do a long form or a short form? It'll vary in certain states. And if they have LIS already in play, well, they're already getting that assistance. You do already have a continuous special election period. But if they qualify for a Medicare savings plan, that might be the additional piece of qualification a person needs for a dual special needs plan in many markets, where the benefits are so much more robust, I think is a good word I'm looking for here, and it can really help that person's financial situation month to month. So we can do some different things with different carriers as well. We can get as involved in the process as we'd like to. We can send them to a Social Security office or help them. There are different carriers that have services that come into play for this as well. The My Advocate program with United Healthcare, the benefits checkup program through either Humana or Aetna. There are a number of programs that carriers have in play that can help with this circumstance as well. And if this is an area that you want to be very aware of, or perhaps even target as part of your marketing program, the carriers do a very good job of making certain you have the information to be successful in this niche market. Once again, we got to make certain that the paperwork goes to where it needs to go. We can do it a hand delivery, the person can do the delivery, or we can mail it. You know what happens when we go paper? It delays the process. Doing some things online can really make certain that we do things on a timely basis. Once again, just a reminder that supporting documentation doesn't have to go in with the applications. And so the person needs to be prepared to supply that documentation if necessary. Generally, everything's just verified through access to the other governmental programs. God bless the IRS. There is challenges you may have with someone who may not have a lot of income but have a failure due to the assets test. If the person looks to give away that money, well, gee, there's a look-back period of 5 years with very few exceptions. Some of the exceptions that come into play, though, if a person has additional cash resources that put them over the limit, and they have a car that's not running very well, or a house that needs improvement, putting the monies into that is a viable exception. If the person were to take that money and give it to church or give it to a family member, it's not. So there are certain things that the person has to do if they're looking to move assets and become eligible for this program. It takes up to 60 days for one of these applications to be processed. So when we look at the SLMB or QI1 programs, we noted that they may go back and back credit the individual for money they paid for the Part B premium when they're going through the application process. So it's important to keep that in mind. And it's also important that if you help a person complete the application, they do things completely. Don't round off, give them exact numbers whenever possible. There are certain states, too, that may have some certain challenges initially when a person gets set up on a QMB process, because it is taking care of a lot of the expenses the person would have in a regular world here. And there may be certain things where they have to refile claims initially when they go on their programs to make certain that those costs are taken care of. There are a number of states that actually a carrier, if they have a SNP program, they go through with a contract with the state to make certain some of this doesn't happen for them. This is actually an exception to the rule. Generally, there's not a lot of challenges once a person gets qualified for these programs. It is important to note that programs such as this have a distinct relationship with Medigap or Medicaid programs. So if you look at the question of who with a Medicare Savings Plan needs a Medicare Supplement program, well, since QMB pays all Medicare out-of-pocket costs for E and B cost sharing, QMB should not be sold a Medigap policy. And there is a 2-year suspension for Medigap when a person qualifies for QMB, where they can cease paying their Medigap premiums as they qualify for it. But if they lose that assistance in the future, they can go back and get that policy without medical underwriting. Since the SLMB or QI1 person only receives a Part B premium subsidy, these folks are someone that would have to look at their budget and assess as to whether or not they can afford a Medigap policy. But these are also people that, remember, all three categories have a continuous special election period. If there are Medicare Advantage programs in that area, that can be of great help to them. If you look at folks that are also getting long-term care Medicaid, at home it's just like any other of the community-based programs, but if they go into a residential facility, a nursing home or whatever someone chooses to call that facility anymore, QMB does pay the SNF daily co-payments for days 20 through 100, and that can make a difference for an individual. As we mentioned before, an MSP recipient automatically qualifies for LIS. If they don't choose a Part D plan on their own, they're facilitated into a plan by CMS, translation, they enroll them in one at their discretion. It's important to note that if we go through and we help evaluate people based on the medications they're taking, we all know that one program's formulary can vary from another plan's, and it can be a great assistance for us to, or great benefit for a person to go through and do that analysis. There is also an inverse relationship with folks that do an LIS application, where based on that program, it can trigger the MSP application process, and the person then can go through it a little bit backwards compared to what we did before, where they have their medication assistance in place. They then go through a qualification process for MSPs. If they qualify for it, obviously they get it. If they don't, no harm, no foul. There are additional resources for you here too that can help you with these eligibility charts and different pieces that come into play, different ways that you can access additional resources. And the National Council on Aging has a ton of really nice educational pieces, much of which the information for today's presentation was borrowed on their LIS MSP programs, but they also give you some information through brain sharks, through different programs online that can help you better understand these programs, in addition to the recording of today's presentation that you're going to get. They do also offer additional information on the SNAP programs, the Supplemental Nutrition Assistance Programs. We will be sending these programs to you as follow-up to today's presentation, but they are available on their website as well, in addition to the Low-Income Home Energy Assistance Program, and additional information about the folks that are most impoverished for the Supplemental Security Income Program, SSI programs. So if this is something that you are prepared to deal with, keep in mind half the Medicare population may qualify for this assistance. It can be a very integral part of your overall marketing program, and if you determine that it is something that you want to look more deeply into, well, it behooves you to become very, very knowledgeable on your state's particular circumstances, if there are any additional programs there, if there is a Medicare Medicaid type of program that is a demonstration product. There are certain states where that comes into play. However, as you assess this information, you determine it's part of your plan moving forward, well, make certain that you study up and you actively market in it. Because if you're just selling Medicare supplements, good for you if that's what you choose to do, because those folks may have additional discretionary funds to buy into other programs, but this is half the Medicare market. So become part of it, don't procrastinate, work through it, look at the different Medicare Advantage programs that can really augment these programs, and become passionate about it. This is the contact information for our organization in the Dallas office. Myself, Justine Sawyers, and Carrie Burnell are available to help you. You can reach our central office at 1-800-365-8208. So if you're working with another Premier Marketing marketer, obviously you can reach them through this number. We'd encourage you to do so. They will have all of this information for you as well. But for the folks who've raised their hand interested in this program, you're going to be receiving it as part of the follow-up as well. One of the things I want to show you really quickly are the websites that we referenced here. Pardon me here. This is actually a Medicaid Made Easy presentation that is made available through United Healthcare. They have a wonderful selection of different information through the Brain Shark programs online that goes through and describes the program generically, and then gives you additional information about Medicaid. This is the benefits checkup site through the National Council on Aging, a nice piece that's available to you to help with a number of different assistance programs. This is the piece I mentioned where you can actually see, in addition to the PowerPoint, different recordings from the National Council on Aging on different assistance programs available to folks who qualify. And then, as I mentioned, folks are receiving letters in May and June that tell them that they may qualify for additional assistance. It's nice to have this information made available to you, and keep in mind that these links do come to you as part of the follow-up to today's presentation. Once again, we invite you to reach out to us and become involved in these programs, become more aware of the assistance that you can make available to your prospects and your clients, improve the quality of their lives tremendously, and this information will be sent to you once again, both recorded form, hard PDF as well on the attachment, along with some additional handout information that can help you with the different levels of assistance. We invite you once again to become involved. We look forward to visiting with you about these programs in the near future, and we wish you good selling. Thanks a lot.